What are the signs and symptoms that makes you think that the child may have Kawasaki's?
So I can describe all the things that I see that I put together as the puzzle, but the amazing thing about this disease is that every parent, given the right information, can make the diagnosis. This is a visual disease. It's all right there on the surface. You can see it, okay? So it starts very suddenly with high fever. There's no prodrome, which we're using for our research to what is this, you know, what's going on here.
They're not feeling poorly, they're not running a 99, 100, and then slowly it's like suddenly wham, they have 103, 4, 5?
High fevers, and there's a lot of between children variability, but it's a high fever, and it comes on suddenly. And then over the next several days, the signs begin to appear. So the eyes turn bloodshot, the lips turn red, they may crack and bleed and peel. The whole mouth and inside of the mouth, the tongue is bright red. The hands and feet become swollen and bright red, and a rash usually appears over the body. But the thing on the hands and feet is different. It's really like you just dip them in hot water.
So
they're bright red.
Scalded and the skin peels?
Yeah, demarcated. No, there's no peeling. That's a late sign, and we certainly want to make the diagnosis before that happens. So the acute phase, over a course of days, and look at our healthcare system, where we have a different provider every day, right? So there's no continuity. The parent is the only source. So your point about the history, take the history. Because these signs come and go, right? But the parent holds the key to all the information.
Well, and as a pediatric ophthalmologist, the times occasionally we get called, it's, you know, it's almost an urgent moment, because if you wait too long, the signs that we can help add are gone.
Right.
Some of the inflammation inside the eye that we can find with special microscopes, you know, by day 10, it's not there anymore.
Right.
And I think you were one of the first people to report that, as I recall. But I mean, so having a doctor recognize this early means the diagnosis can be made early and confirmed at least as best as we can clinically.
And if you begin to think that all these outward signs of inflammation, so the body's immune response that's going crazy, these signs on the outside are not dangerous in and of themselves, but they're the hallmark of what's going on inside the blood vessels. And in the wall of the coronary arteries, which is where the inflammation settles, there's the process of beginning to destroy them. And so this is an insidious disease that doesn't look necessarily that alarming from the outside, but is very alarming on the inside.
So the common thing that why the hands and the feet and the eyes, everything, and the mouth is having that all happen, is changes in the blood vessels.
Well, it's the body's response to a trigger that we don't yet know what it is, but it's the immune system basically going crazy. So the two arms of the immune system, the innate immune system, we like to think of that as the first responders, right? And those guys, man, the ambulance is on full charge, right?
They come running.
The sirens are on. And that arm of the immune system is just upregulated and going nuts. And it's driving the fever, it's driving the inflammation all throughout the body, but it settles into the coronary arteries, and that's where the permanent damage can happen.
And